Today we're going to talk about how to wear your hair immediately after a hair transplant. And I believe that this is targeted toward the day of the procedure, the next day, and while the healing process is going on. So what you want to do when you walk out of the clinic is you got to be careful. Dr. McGrath and his team, his colleagues, they'll give you a medical cap to wear. So if you're from out of town, you can get into your hotel room and you won't look like you've got any kind of scarring or any kind of oozing or anything like that. So the medical cap is just a real light piece of almost like a tissue that goes over your head that you put on from the front. Nursing staff will do it. They put it on from the front to the back, so it goes back over the top and ties in the back. The key to wearing this medical cap walking out of the clinic is to take it off immediately when you get home or to your hotel room. And how do you do that? Opposite of how it was put on. So you take it off from the back to the front. Now, why am I doing this with my hands? The key is obviously not to dislodge any grafts because you've just had your procedure done, but that's not so much of a concern unless you whack your head on your car door. That's a concern. But you want to make sure that you don't create any oozing, or if there's oozing, it doesn't stick to the medical cap. So what happens sometimes in a procedure is you could have a little oozing, which is what you may see as bleeding. It's really not. It's fluid that's used in the procedure that's kind of seeping out of the scalp, and it's tinted a little bit with some blood, so it makes it look like blood. If that coagulates and you leave that medical cap on long enough, it can stick to the actual cap, and that's how you can dislodge grafts. So what you don't want to do is leave the medical cap on when you're sleeping at home or in the hotel. So the next day, a lot of the top clinics will bring you in for a hair wash and a final check. Now it's pretty safe that you can use any kind of clean or new baseball cap. That's going to be okay, but you got to be very careful if the doctor has done your temporal peak area, because these are all single-haired follicular units and they're more delicate than even the hairs in the hairline. And obviously when you put the cap on, it's going to hit this area easier than it's going to hit the hairline because you're going to make sure that doesn't happen. So that's just a caution, but you can wear a clean or a new baseball type cap the next day. What you cannot wear for the whole entire healing process is a beanie. You can't wear a beanie because they're either wool or cotton, and they can grab onto a graft which still has hairs in it and pull it out, and that's not going to be fun because that's going to bleed, and it's going to bleed a lot, and you're going to think you ruined everything. In reality, what you did was pulled out one graft. Not a good thing, but not the end of the world. So no beanies. Sometimes what I'll tell my African-American female patients, they're kind of lucky because they normally have just the traction in the frontal zone, which is all the hairline and temporal peaks, and they look, of course, really good in a silk type of head covering, a silk scarf. So they don't even need to cover the whole scalp, but it can't be wool or cotton. The old days, men and women were wearing kind of bandana looking things because everybody wants to walk out of here looking like they didn't have anything done with a medical cap. I would say that I prefer the medical cap, but if you want to go and wear a bandana, kind of like a motorcycle bandana, that's okay as long as it's like a polyester or a silk. And you need to, again, follow the same instructions where immediately when you get back home or get to the hotel, then you take that off because for the same reasons as the medical cap. Fast forward about 3, 4, 5, 6 days, you're pretty much good to go. I mean, after about 4 days, again, unless you whack your head on a car door or a kitchen cabinet, which I always seem to do for some reason when I get a hair transplant, you don't really have to worry about dislodging any grafts. But remember, no wool, no cotton, no beanies. Make sure that whatever you put on your head is clean or it's new. And about day 6 or 7, it's really kind of all downhill from there. And to elaborate on the answer to this question is, how do you wear your hair to go back to work, to go to school? I mean, that's pretty much, camouflage city. Like if you have hair in the front and you had your hairline done, you can use that hair to comb over and cover up the scabbing. If you had FUE in the back, it's going to take as long as it takes for your hair to grow back in. Although my last procedure was FUE and I was pretty normal back there in about 5 days. Now my hair didn't grow back too much, but the redness and when they take out the grafts, if it's done right, you won't see much scarring back there at all in about 5 days, or at least I didn't. And most patients, they don't see that either. I would tell you that be very careful for the first 10 days. If you're an IT person, we have a lot of IT people I talk to, computer people. If you're executives or if you're working in an office environment, then you don't really have to worry too much about anything with your hair transplant. You can go back to work almost immediately. I'd say take a couple days just so you don't have any swelling in your forehead, which is going to make you look a little funky. But you're good to go. If you're a laborer or you're a construction worker or you need to jump in and help your guys out sometime, if you're a manager at a construction site or you do any kind of heavy lifting, if you have an FUT procedure, you need to wait about 12 days till the suture comes out. If you have an FUE procedure, you probably wait about a week and you're good to go. As far as shaving the head in any given area, especially the surgical area, once that's shaved, that's shaved. Now, the zone of transplantation is the only thing that really needs to be shaved, unless you're talking FUE, which you have to shave everything in the back and over the sides. One question came in about, do you have to shave the whole head? No, you don't. It is better for you and it's easier for the doctor and the staff if you're able to shave the zone where we're working in. For instance, my last procedure was right in the frontal zone and it was in the temporal peaks. And I think Dr. McGrath shaved just a little bit on the hairline so he could dense pack it there, but most of my hair on top was all left intact. So for me, obviously helping out viewers and guys like you that are looking for possible hair restoration procedures, it was a good thing because you could see exactly how it looked the day after, 2 days after, 3 days after. So I was good to go. But from a styling standpoint, I didn't really feel much different, although everything was shaved in the back, but I'm kind of liking that now to go real low. But the answer to your question specifically is shaving wise, doctors on this level can do the procedure without shaving. It's gonna take a little longer, it's a little harder to do, and no matter what anybody tells you, it is not as easy to dense pack as well as if you allow them to shave. But in the real world, especially after this virus goes away, hopefully soon, if you have to go back to work and you need your hair and you can't have it shaved, then you have to find a doctor that's gonna work with you and work around that. I know Dr. McGrath is willing to do that with all patients. You just have to be very good communication and make sure that he knows that prior to going into your surgery. And that's all done in the preoperative consultation. So yes, you can be successful by not shaving your head. Of course, we have to shave the sides and back for FUE, but make sure you understand that if you can allow your doctor to shave the area of the surgical area, he will be able to pack it tighter. So I hope that helps you out. And it was great to be here again and answer your questions. Keep watching the YouTube channel and subscribe to Dr. McGrath's McGrath Medical YouTube channel.